You are listening to The Dish on Health IT, brought to you by Point of Care Partners, a leading health IT consultancy. Each episode will feature a rotating panel of senior consultants and guests who will talk about trends and innovations in health IT, while also highlighting how organizations can leverage these advances to solve their business problems. Today's episode focuses on application innovations in healthcare. Our panelists, Senior Health Information Technology Consultants Gary Austin and Ken Kleinberg, welcome guests Schiller and Mark Hughey from Arcweb, a Philadelphia-based software development firm working on a variety of software solutions in healthcare. The conversation today covers areas where APIs are being deployed, like patient scheduling, digital therapeutics to augment disease management, and rare disease diagnostic tools. The crew goes on to talk about effective approaches to innovation, key metrics of success, and how COVID-19 has been a driver towards accelerated innovation planning. I hope today's podcast helps you think about your next innovation project a little differently. We hope you'll share your topic ideas with us by emailing us at podcast@pocp.com.
And good day, everyone, and welcome to the ongoing adventures of the Dish on Health IT. I'm your host, Gary Austin, affectionately known as Lumpy, and coming to you now from the beautiful Finger Lakes region of upstate New York. We at Point of Care Partners are health IT consultants with 100 plus associates in over 35 states. We work across all stakeholder groups: payers, healthcare delivery, pharma, health IT vendors, and government agencies, and we're viewed as an independent, trusted party, the Switzerland of consultancy. With me on the Dish on Health IT is my co-host, Ken Kleinberg from the Capital Region of upstate New York. And we've got a couple of really great guests this episode as we focus on application innovation and accelerating solutions in the new API world. So Ken, how about a quick hello and some opening comments from your end?
Thanks, Ken Kleinberg here. I've focused my career on advanced and emerging technologies, and I truly embraced my title here at Point of Care Partners as practice lead in innovative technologies. I was a systems analyst in the 80s, an application development analyst in the 90s, and a health IT industry analyst ever since. And I view health IT as a key component of advancing our struggling healthcare system. I'm really looking forward to the conversation today.
Great, thanks for joining me, Ken. In addition to Ken and myself, today we have as our guest, coming from one of my favorite urban hangouts of Old City, Philadelphia, two principals with Arcweb, a really innovative software application development and skunk workshop. Mark Hughey is the principal consultant, and Schiller is the head of marketing and leads healthcare research and strategy for the firm. I think it's important to note, being a Red Sox fan as I am, that this is not the same Kurt Schilling who was instrumental in winning the Sox their first World Series title in 100 years. So don't be confused by the names. Just in case anyone
you wouldn't be the first person to make that mistake.
Yeah. So Mark, why don't we start with you, a little bit of your background, and then Kurt will come back to you, and then we'll start and roll into some of our questioning. Mark?
Sure, absolutely. As you said, I'm a principal consultant at Arcweb, which basically means that I lead integrated project teams in a variety of engagements with our clients surrounding product strategy, design, development, really the full life cycle of software development and how those products live. I spent about a decade plus in my early career doing federal government consulting for primarily the Department of Health and Human Services, lots of business process reengineering, general management consulting, and things like that, and then moved into technology from there. And been really kind of leading innovation efforts in healthcare for Arcweb. So excited to be here.
Great, excellent. And Kurt?
Yeah, so like you mentioned, I'm Kurt Schiller, and I am the head of marketing at Arcweb. I think, like is the case at a lot of companies like ours, the head of marketing does a lot more than just marketing. I started originally actually as a technology journalist out of college, and I covered the archival and library sciences in kind of the mid 2000s as they were rapidly adopting technology. Then I transitioned over to working in content strategy and customer experience in consumer technology for a few years. I've been working in healthcare for about 6 years now. I worked for a couple of years implementing digital experience for several regional managed care plans, working with Medicaid patients and practitioners.
And that was really where I started thinking deeply about the ways that technology and digital experiences can have a really massive impact on people's health and lives. And I continue to do that at Arcweb, where I work on a variety of market and customer research. I also write extensively about changes in healthcare in general and digital health and health IT in particular. And I would say lately, I've been casting a very close look at the use of patient data and interoperability, especially where it intersects with the world of software, which is where we live.
Excellent. A deep thinker and a communicator. You guys are a nice bundle here to have as guests on our show. So let's get on with our discussion a bit. Ken, as we often do with your sort of broad lens on the market, can you set the stage around software innovation and impact of APIs and how we accelerate the industry?
Well, sure. Thanks, Gary. So let me start with the enterprise electronic health record vendors. By saying that despite their enviable market share, their huge R&D budgets, they really can't do everything for everybody, or at least they can't do it as fast as many would like. And even if they wanted to, there have been so many advances in application development platforms and approaches over these years that these current leading vendors are often basing their development on platforms that may be even a few decades old. Now, most have built out capabilities on some of the new mobile platforms, and most have provided proprietary APIs for third-party development. And granted, we've had this rise of the app stores, and that's made it easier for third parties to develop software that works with these EHRs. It's all been a plus. But in the end, these app store platforms have also been proprietary, and they're controlled by the vendor. So make no mistake that these EHR vendors have been gatekeepers for what gets developed. And whether you want to call that information blocking or not, well, that's up to you. Now, this year, of course, we've had a game changer. Via the CMS and ONC final rules, we're going to see the rise and the mainstreaming of open APIs and the freeing of the data, if you will, at least from a read point of view, not necessarily from a write point of view. But even so, for developers, this is a huge opportunity to, call it nip around the edges or fill in the white spaces, create these custom capabilities, or even maybe boldly go where no EHR vendor has gone before. And we're talking about the opportunity to improve business processes and productivity, deliver marketplace innovation, and in particular, engage with patients and members with increased functionality, including stickiness and user experience efficiency.
Great, yeah, great overview, Ken. The age of data blocking, I think, is shortly going to be behind us. So, Mark, I thought we'd start with you. Arcweb is in the world of innovate and accelerate, right? That's probably a couple of good words to frame you guys up with. Not heavy enterprise production apps. So let's start with an overview from your perspective on where do you see the opportunities for innovation and acceleration for health entities right now?
It's funny you use the term acceleration because as we've started to publicly talk about innovation and like where we think the important and salient points are in this space, I kind of blended my personal motorsports passion, and I happen to be an amateur race car driver, and I really looked for this way to build on an analogy to try and make the message, a little bit more palatable and entertaining when we're out there, speaking to people about it. And so I kind of like used this analogy of race car driving and what it means to be a high performance race car driving team and perform well in these races, and how we can associate some of the lessons learned in that space to where we are in innovation, even in healthcare. So it's funny you use the term. Specific to healthcare, one of the things that Ken just touched on was patient experience or user experience, and we've seen this blanket term, patient experience, been thrown around a lot lately, and really what we're seeing is that a lot of that effort, at least, is an acknowledgement of the fact that patient and user expectations are drastically shifting. People are seeing these highly customized and personalized experiences in all the other aspects of technology in their lives, and they're wondering why healthcare one doctor doesn't know what the other doctor knows, and they're not sharing notes, and
Right.
all these basic things about technology. And so that's really, a lot of what we do is kind of focusing on that opportunity where, as you indicated, also there's some regulatory pressure, to start opening up some of this functionality. And so, that whole patient experience, bridging that gap between how these processes were built around what was best for the provider or the organization. And now we really need to figure out, like, what's the best for the patient? What makes it easier for them to consume the information that's important for them to be able to make decisions about their health? And the last point I'll make is that probably more importantly than where or what the innovation opportunities are and where they exist, more important than that is what we've been talking about, which is how to innovate. You can identify all the right places to innovate, and then if you're not really good at executing on that mission,
Very fair.
then it's all for naught, right? So, and this is, we've seen statistics like 80% of all innovation projects fail. These are reported polls by enterprise executives. We see statistics like 55% of healthcare organization leaders are saying, like, they don't even have a really good process for measuring whether their projects are succeeding or failing. And so that seems like a really big gap. You can't address where we should be innovating without also addressing how we should be innovating.
Yeah, good points. Good points. I had a mentor of mine years back tell me, actually, I don't pay you. I was a COBOL hacker back in the old days, God forbid. And he said, I don't really pay you for how much code you write. I pay you for how much code actually works. And I always kind of took that to heart. It's not volume, right? It's value. So, Kurt, what you have some really highly innovative customers out there, right? And you're leading edge with some of these firms that you're dealing with, different IDNs and health IT vendors and payers and whatnot. Without naming clients, give us an idea of a couple of sort of highly innovative projects you're either working on or you've discussed with your clients or are coming up in your queue.
Yeah, I'm happy to name some general clients. As you say, it's a little bit tricky to talk about current projects with current clients. Sure. But in a general sense, you're correct. Arcweb has done a lot of work with especially regional healthcare delivery networks in and around Philadelphia. We've done a lot of work with Penn Medicine and Children's Hospital of Philadelphia, both of which have significant integrated delivery networks with many locations. CHOP sees upwards of 1 million patients or does upwards of 1 million outpatient visits a year. I would say that a lot of it, I would just echo what Mark was saying. That it's a question of where do they invest. There's so much that can be done right now with the adoption of technology, but 3 things I think that we're working on right now or have just finished working on that maybe nicely tee up 3 different areas where we are seeing a lot of innovation. So one of them is an online appointment scheduling project, and it really speaks to the customer experience expectations in healthcare that Mark was mentioning. Customers or patients, coming from consumer applications increasingly expect to be able to go to a website, find their doctor, book an appointment. And until very recently, that has been, just not really something that was widely available. And it's not because of a technology barrier. It's because of a business barrier. It's because of a software architecture challenge. And so, that patient experience, as big of a term as it is a really powerful thing that I think health systems in particular are looking to invest in and innovate in, to bring these kind of typical consumer capabilities into the healthcare world, because they are huge differentiators in a way that it previously hasn't been. If you have an option of call someone and sit on the phone for 20 minutes or go to a website in 2 clicks and boom, it's done. Huge upside in terms of patient acquisition and in terms of patient experience, overall outcomes. Another one is, we're working on a data platform that's involved in rare disease diagnosis, where we're trying to capture some of this data that has been stored electronically, but not always in a way that is accessible or that can be harnessed for data applications. And we're working to surface that and make it more available to a greater number of clinicians, so that they can, better serve patients. And this, I think, is this big drive right now to not try to automate humans out of healthcare, but to bring technology in and augment the capabilities of clinicians so that they can treat more people more efficiently and better than just a person could, or even, multiple people could. And the last one is really interesting. It's something I'm very passionate about, is we're working on a digital therapeutic project right now, where we're using, consumer style apps to work towards behavioral management for the direct treatment of healthcare conditions. It's actually a spin-out project of a regional health network. And just the notion that technology itself, that the experience itself can be a form of treatment, I think is something that on the clinical side, people are very interested in, and on the consumer side, there's a lot of demand for, and just, on a personal level, I think it really speaks to the fact that, you can have a direct and visible impact on people's lives. It's a ton of, really exciting stuff going on in this industry right now.
Very cool. It's a cool, several very cool projects that you guys are working on. So, Mark, as a guy thinking up the solution architecture for a ton of these projects, you have a very different perspective than a traditional production IT manager. Somebody who's keeping the lights on and occasional release update and things like that. When you have a discussion with a potential client, what goes through your creative mind? How do you think about bounding their ideas into something that can be delivered at a reasonable time frame, at a reasonable cost, with a reasonable level of risk, versus, I'd like to just take on the world here and and build another SAP or something like that? How's your brain work when you're talking to clients like that?
Yeah, I mean, that's a great question. We, very often we're even engaging with clients before the ideas that they have are even fully baked. But they need help with that, but regardless of how mature the ideas might be, it's really important for us to set those boundaries early on, so that we don't get caught trying to boil the proverbial ocean. And so one of the things we do very early, basically at kickoff, is introduce the concept of the iron triangle, which essentially consists of the three primary factors that influence the trajectory of a project, that being scope, budget, and time. And so we can optimize for any one of those three, or potentially like a combination of a couple, but certainly not all three simultaneously. Ideally the client would love we want every feature that we've ever dreamed of, and we want it to cost half of our available budget, and we want it delivered yesterday, right? Like that, that's the ideal, and obviously we can't get there. And so we've got to establish a framework up front for talking about what are the priorities, right? And those are typically driven by some combination of business drivers, stakeholder expectations. Is there a deadline associated with this? Is there an absolutely do not exceed dollar amount? Or is it like a thing where we have as much money as we need, and this thing's got to actually work? Like it's a beast of an application. We need all of the functionality, making sure we get all that done. We're willing to take more money and take more time if we can get all of that scope. So, but we have to know what those limitations are and what those expectations are, so that we can talk about that, up front, and tailor our recommendations and approach accordingly. And then when we get into it, like we also typically, once we set those expectations, we also, as part of the implementation of the engagement, we will typically do a design phase first, where we don't have any engineers. We've got a software architect We've got somebody like me that can talk about product strategy, and we've got a UX UI designer, and we try to rapidly iterate through designs. What is this thing going to look like? What do we need to do to achieve all the goals that that the user is going to have, and get all that stuff out on paper and fail a couple of times without writing a line of code first. Then once we get solid on design, then we ramp up the engineers and start building it.
Got it. So let's dive a little bit deeper into that. It's one thing to build a solution and wave the mission accomplished flag, right? But it's another thing to show that you have an actual ROI with it, either administratively or clinically. How does Arcweb look to help their clients measure success over and above, I developed something?
Yeah. So being able to point to success is one of the key messages that we point to when we're talking about how to build an innovation framework. You've got to be able to measure what's going on. I mean, if you can't point to, we've moved the needle on something, we've improved patient experience, we've improved outcomes, health outcomes, we've reduced costs. There's got to be a way to measure what you are investing in. Otherwise, what's the point of the investment? Right. So, part of that goes again back to kickoff, in discussing those business drivers and stakeholder expectations, because those are the people really that need to ask. When we get done with this and we're all high-fiving each other and breaking out the champagne, what is it that we're celebrating, right? What does success look like to you with regard to this engagement? And when you get people in one room talking about what success looks like to them, sometimes you find out not all of them were on the same page as to what success looked like. And it was really important to have that conversation and come together as a team, for, how are we going to march forward to get these things done?
I'm thinking about that earlier remark about the percentage of innovative applications that were considered failures. By whose definition? It could have been that they had a lot of great aspects to them, but if the expectations were too high at the beginning, then your track record may not look as good as it truly was.
Yeah, or not even too high, but just different, right? Or not well quantified or whatnot, and that sort of stuff. Kurt, I'm curious, as your role as marketing lead there, when you get a new client and you have a successful app developed, right? Mark and his team does a great job. They pull it, the clients are happy and stuff. Did they tend to come back to you oh, we got another one? Or do they tend to come back to you we got 10 more we'd like to do? And you got to sort of throttle them back a little bit and stuff.
So, I think, Arcweb does probably about half of our business is strictly healthcare, and the other half is a mix of a variety of different industries, and outside of healthcare, it's often we have this one project, it's a well-defined business goal. I think that our experience in healthcare is that there are such an abundance of different ways that you can take innovation that it's very much that we have 10 ideas bouncing around. We're trying to get budget for all of them. We're trying to figure out which ones are going to have the biggest impact. Certainly, we love to advise people on how to, exactly what Mark was talking about, build that innovation strategy out, so that you can, cunningly select which of those 10 projects you should be investing in. And the thing I would note about that is, compared to our work on the consumer side, the different possible metrics of success are so much more confounding in healthcare, because like Mark said, it could be for clinical outcomes, it could be for revenue, it could be for patient acquisition, and those might be oppositely aligned. You might lower your revenue, but you need to get your HEDIS score up or something. So you're more you care more about clinical outcomes in this moment. Whereas, on the consumer side, if you can generate revenue, I don't know a CEO who's going to be well, this isn't what I wanted. In healthcare, there's so many different more stakeholders with different, not always aligned expectations. But certainly, I would say it probably drifts more towards the we have 10 different things that we're investigating. Which ones should we go towards?
Yeah, it's interesting. I suspect revenue is going to be top line revenue is going to be a whole lot more important post-COVID here, right? as we come out of this, because everybody's lost 3 or 4 or 5 months worth of, significant revenue, or certainly their high marginal revenue and things like that. Ken, you've done a lot of work with companies around, how to measurement and things like that. Anything to weigh in here on that, in terms of what companies need to do?
Well, I was just thinking about, a concept that's been used for decades, the balanced scorecard. And there is that fifth dimension that you could add to the usual 4. And you could call it an innovation measure or an excitement measure, or, getting people motivated measure. So, that's something you have to look at. In healthcare, we could say it's more complicated than other industries. I think that's fair. So will only a handful of measures be enough? No, they won't. And they're going to continue to change over time.
Got it. So on the balanced scorecard, excitement would be probably the blue light or something like that, I'm guessing, right? You'd have to have your own light for it. So I remember those big dashboard measurement things back in the 90s there. So guys, let's talk a little bit about, so COVID changes everything, right? And this has certainly been, I would think, for somebody like you guys, has been a real business driver, because now all these companies, all these healthcare entities are like, oh, I've got to be able to do this quick. I've got to be able to, interact with public health. I've got to be able to move resources around faster. I've got to be able to do a lot of different things here. How did this pandemic surface critical, rapid innovation for you guys? How do you think about it, and sort of what are you seeing out there? So Kurt, maybe start with you, and then Mark, if you want to weigh in on this one too.
Yeah, I think you're absolutely right. It has been a huge driver of thinking towards innovation. But I think one of the challenges that has come up is the time frames are so compressed. The impact on healthcare revenue was so dramatic that proposing a project that is, it's going to take us 10 to 18 months to get this telehealth solution up and running, that was maybe not going to cut it. So I think in the past few months, we've probably seen a lot more investment in what can we rapidly put together that will deliver the clinical care that we need, and won't be totally out of whack with what our technology expectations is. You don't want, we talk a lot about technical debt, which is always a big challenge in healthcare. This idea that if you kind of kick the can down the road technology wise, if you go for the most immediate, short term, easy solution, you're going to cause yourself more and more and more problems down the road. And I think you're starting to see this with a lot of the EHR decisions that have been made over the past 15 to 20 years, where it's like all of a sudden we're kind of stuck. We have this burden of all these past decisions. But I think that given the short time frame, you can forgive a lot of health systems for you have this enormous patient need, massively different healthcare and delivery expectations. And so they kind of had to do whatever they could to serve that need, to get up these remote care options. I think that in the next 12 months, is really probably where we're going to start seeing people being able to take a step back, hopefully, and say, okay, we had to go by necessity, maybe a little bit off course from where we wanted to be with telehealth rollout to meet this sudden drastic change. How can we bring that back in line with a kind of a more planned and thoughtful technology strategy, so that we don't, build ourselves into a stovepipe of technology where it's like we want to innovate, but we also have this big complex system that doesn't align with that. So I think we haven't seen it yet.
Got it. Mark, how about from your perspective as sort of, chief designer, chief kind of, solution architect?
Yeah, the thing that this really that COVID-19 really highlighted for me was the absolute necessity to have the kind of framework that we're talking about. Like, how do you separate the okay ideas from the really great ideas, from the bad ideas, and make sure that you're directing money? Because even before this, right, budget, resources, time, those were all limited resources that were not being well optimized in a lot of cases. And now, like, we've exacerbated the budget problem because, elective procedures got shut down and the revenue all went away. And what does that mean for the rest of the 2020 budget? What does it mean for the 2021 and beyond budgets, for innovation? And if you didn't have a great system to be able to pick the right thing to do and focus on in the first place, now you're really on your back foot with regard to, how do we make the best of the situation that we have?
Got it. Good. Ken, thoughts there?
It seemed like the bar was awfully low for what was being asked. Like, can you email a spreadsheet of your, ICU capacity? With these modern environments, I think it's possible to create relatively high-functioning apps that have great user interfaces, that are connected to the right data sources, that can do the kind of reporting and aggregation and so forth that people need to see in pretty short order. I mean, I remember back in the old days that you could create a demo or a pilot, which was really just, mocking up the screen. And you ran that risk of the executive saying, oh, that looks great. You're done, right? And then you say, no, the real hard work has to go on behind it. But with the kind of app dev environments that we have today, literally when you've mocked this up, you've got something that can actually work. And now you can add some scalability, which also is fairly automated today, and create something pretty powerful pretty rapidly. So I think times have really changed in that respect.
Yeah, it's interesting. It feels to me when I look at, and we do a lot of strategy work, obviously, and product roadmap and things like that. And I don't see a lot of firms that have sort of a set aside strategy for what their innovation is going to be. They have a strategy for their production operations and things like that. And, oh, by the way, a couple things float up here and there around innovation, rather than sort of a conscious strategy of, what's the 10 things we're going to look at this year as to whether we can innovate and make a difference either administratively or clinically or from a consumer standpoint or things like that. I don't see a lot of firms that consciously sort of do that. And it seems like a huge opportunity loss to me.
In technology, I think in healthcare technology in particular, there's a big challenge right now structurally, I think, in a lot of health systems where, if you look at the three areas where innovation could happen, you've got innovation labs, you've got the research side, and then you've got the kind of core IT ops. And the people in that kind of triangle there who have the clout and the resources, core IT ops and research, either don't have access to the core IT capabilities in the case of research, or in the case of core IT, their goal is, data security and risk management. It is not driving innovation. So many healthcare systems have these powerful innovation labs that just don't have the resources or the access to be able to innovate. And I think that's part of the thing that we try to add value to, is to find ways to empower people within those systems. But to your point, the challenge is not the technology architecture, it's the human and business architecture that's the big barrier right now.
Yeah, very fair, very fair. So guys, this was a great conversation today. I really appreciate both of you taking some time away from your day jobs there to chat with Ken and I. And, in a phrase, what would you say about innovation to, a marketing lead or a product manager or whatnot, either at an IDN or a hospital system out there, or maybe a payer out there, or a health IT vendor that's looking to innovate? Mark, let's start with you. Why don't you give me a sense? Well, if you had to say one phrase to these guys or ladies in terms of what they're going to do, what would you tell them?
One phrase is always tough to boil it down to, right? But I'll steal a phrase that I've been using in my presentations to close them with, and it's meant to be a little inspirational. And the phrase I use is, as those responsible for bringing technology solutions to life that enhance the health and well-being of the people we serve, we should be unwilling to be less than we can be.
Nice, very nice. Kurt, how about from your end?
My advice, especially when it comes to innovation and the adoption of new technology, is always going to be the same, whether it's healthcare or somewhere else, and that's, don't let yourself get distracted by shiny objects. There's so many different directions that innovation could go. People have been talking about blockchain and AI for a number of years, And those are awesome. They're cool. They're exciting. It's very cool to say that you're working on and deploying these solutions. That may not be what it takes to deliver better patient care. Don't overlook something just because it's not exciting to talk about. It's the results that could be exciting, especially when people's lives, literally are in the balance. Don't overlook technology just because it's boring.
Interesting. Yeah, the Southwest Airlines model, right? You want to make more money, queue the people up ahead of time before the other people get off the plane, right? So, Ken, closing words from you?
That's a good example. You think there are only so many ways to load an airplane until you see the way Southwest did it. And it's like a lot of innovative ideas. It seemed like there wasn't anything left to do, and then someone comes up with something that's so elegant, and why didn't we think of this before? And I think innovation also leads to more innovation. So when you're hanging out with people like Mark and Kurt, then innovation is going to flow.
Got it. Very, very good. Well, guys, thank you all for joining us today. I much appreciate it. That's our time for this edition of the Dish on Health IT. Many thanks to my co-host, Ken Kleinberg, and hopefully next week we'll welcome back Jocelyn Keegan to rejoin us. Thanks to Mark Hughey and Kurt Schiller from Arcweb in Old City, Philadelphia for their great insight into healthcare software acceleration and innovation. We'll be back in a bit with the next edition, so please subscribe to us, whatever podcast carrier you use, Apple, Google, or whatever. If you have any speaker thoughts, or if you have comments or suggestions on this podcast, please email us at podcast@pocp.com. Goodbye for now, and remember, health IT is a dish best served hot. Good day, everyone.
Thank you for listening. If your organization needs help understanding the FHIR landscape and developing or updating your interoperability roadmap to reflect requirements of the recent CMS and ONC rules, reach out to us at info@pocp.com.